So my name is Rachel Hartline. I'm a family doctor in Dodgeville, Montfort, and Highland. My husband and I have beef cattle, and that's probably the biggest consumer of our time. We have about 35 Galloway beef cows. I had a friend in high school actually who said that I think you would make a good doctor, and then I started thinking, yeah, I think I would. You know, in every step along the way, it just has sort of been a confirmation of that. It's a career where I can give back to people, and I think that uses my strengths well. I really love being able to take care of people I know. I think there are people who shy away from that because it feels like it's hard to find boundaries, but I really, it is such a pleasure to me to be able to take care of people who I know in my daily life and that they trust me. For me, I think it's really important that the patient and I be on the same page, and often we're starting from really different places. You know, I need to meet people where they're at, and you know, whatever sort of changes I propose, I think they need to fit into your lifestyle. Probably every couple of years, I make it out of the country and do some cervical cancer teaching. So teaching providers, healthcare providers like nurses and doctors in other countries how to do cervical cancer screening, so that women in other countries don't have to die because they don't have access to a pap smear. I really have been impressed with the ways that the community kind of reaches out to people who are struggling, and the way that, sort of getting to know the networks of my patients, like, oh, you're so-and-so's aunt, I didn't realize, and putting all those pieces together has just been really, really lovely, and I think that's been true in all the places I've worked in Iowa County. I'm kind of old school. I really love being a family doc who does all the things. So I still care for my patients in the hospital. I still deliver babies. I do C-sections. I just really like being able to practice that full spectrum of medicine. And I feel like that's more, well, it's easier to do in a rural setting because there's less, you don't have to, deal with specialists or decide who's going to do what because you're the one who's there. And also I feel like it's a place that needs it.